Why do some cancers keep bouncing back, even after being blasted with the best treatments science has to offer? You'd think finding the right genetic mutation would be the silver bullet. But lately, researchers are peering deeper, beyond the DNA code itself, into a shadowy layer that's quietly rewriting the rules, epigenetics. Let's dive into this hidden world. Imagine your genes as a massive instruction manual. Epigenetic modifications are like sticky notes and highlights, deciding which pages are easy to read and which get skipped entirely. The main players: DNA methylation, histone modifications, and non-coding RNAs. These don't mess with the actual letters of your DNA, but they control how those letters are read. A bit like bookmarking the instructions for a nuclear reactor and hiding the fire extinguisher manual. Now, here's where things get really interesting, and a bit sinister. Tumors are crafty. Even when I hit them with treatments designed to target precise mutations, epigenetic changes can help those cancer cells shapeshift and adapt. First up, silencing tumor suppressor genes. Tumors can use DNA methylation to switch off the very genes that should keep them in check, like pulling the batteries from a smoke detector. This makes therapies like chemo and radiation less effective, as the cell's natural brakes are gone. Secondly, tumors can ramp up drug resistance pathways. Through epigenetic tweaks, cancer cells can crank up the production of tiny pumps that flush drugs out before they can do any damage. They even rewire their metabolism to survive in harsh conditions: low oxygen, scarce nutrients, you name it. Then there are cancer stem cells, the ultimate survivors. Thanks to their epigenetic quirks, these cells can stay dormant during treatment and then regrow the tumor once the coast is clear. It's a bit like chopping weeds but leaving the roots. They just keep coming back. And what about the immune system? Tumors can use epigenetic modifications to hide their identity, switching off the flags that would normally alert the body's defenses. This makes immunotherapy, one of the most exciting cancer treatments, much less effective. But here's the good news. Scientists are now developing epidrugs, medicines that target these epigenetic changes directly. DNA methyltransferase inhibitors and histone deacetylase inhibitors are already making their way into clinics, sometimes in combination with other therapies. The goal? To flip those genetic bookmarks back, reawaken silenced genes, and make tumors vulnerable again. Looking ahead, the real magic might lie in personalization. By reading a patient's unique epigenetic fingerprint, doctors could predict who's likely to respond to which treatment, who's at risk of relapse, and how best to combine therapies for maximum effect. So the next time you hear about drug-resistant tumors, remember, it's not always about the genes themselves, but which parts of the genetic manual are hidden or highlighted by epigenetic marks. By learning how to tweak these subtle changes, we're getting closer to outsmarting cancer at its own game and giving patients a fighting chance. Thanks for watching.